Hello everybody and welcome to my YouTube channel. So today I'm going to talk to you about hiccups among newborns. Well, let me tell you, hiccups among newborns is an extremely common condition. But then as a parent, when we see our little one having these hiccups probably after every meal or very frequently, it kind of worries us. As a parent, it really worries us, right? So not to worry. So today I'm going to discuss with you as to why it happens, what are the different reasons as to why it happens, how we can prevent it, and those certain conditions that we really need to be alert of, and we should be a little concerned when it happens more frequently. So stay tuned. Let me brief you out about the mechanism of hiccups. So we have a diaphragm, which is like a large muscle that is present at the base of our rib cage. Okay. So now when there is something which is triggering the diaphragm, what happens is that muscle contracts and even the muscles of the vocal cords also contract. So there's a sudden gush of this air which needs to pass out. So when this air passes out through those closed vocal cords, it creates a kind of a hiccuping sound. That is what the basic mechanism is. So basically there is something which is triggering this diaphragm or the muscle which is present at the bottom of our rib cage. Now these newborns have a lot of reflexes, right? Like sucking reflex, neck reflex, a lot of other reflexes. So even hiccups is also a sort of a reflex action among babies, wherein it is a way where they try to eliminate the excess amount of air within their system or probably from their stomach. So now this can happen when the baby either overfeeds or tries to feed in too quickly or probably engulfs in a lot of air while feeding. So as a result, what happens, the baby's little tiny stomach starts expanding and it pushes against this diaphragm. So when it does that, the diaphragm, the muscles of the diaphragm, it starts contracting, and then like I said again, the vocal cords contract and then the air is forcefully being tried to be pushed out. So now how do we stop a little baby from having hiccups? So let me make it clear again, hiccups do not generally harm a baby. Like as an adult, when we get hiccups, we feel a little uncomfortable, distressing and annoying, right? But it is not the same with babies. Probably if a baby has hiccups, even if you leave the baby quiet for some time, it will naturally automatically stop. But if you feel that the baby could be in a little bit of distress, then here are a couple of tips which I'll be telling you that should be done to stop the hiccups. So the first one is take a break to burp the baby. Now, according to the American Academy of Pediatrics, they say that it is a good idea to burp bottle-fed babies every time they consume 2 to 3 ounces. And if the baby is breastfed, it is a good idea to burp the baby while switching between the breasts. The next one is using a pacifier. Sucking on a pacifier may help to relax the diaphragm and stop hiccuping. The third one is feeding them on gripe water. Now what is gripe water? It is just a mixture of herbs and water. Now the most commonly used herbs are ginger, fennel, cinnamon. Okay, now this also helps to treat babies who have regular colicky pains and other stomach issues. The next one is rubbing the baby's back. Rubbing their back and rocking the baby back and forth can also help to relax. Now this may also stop the spasms that can cause hiccups. Well, I've also heard some parents come and tell me that, ma'am, we've tried certain techniques like making a baby jump when the baby has hiccups, or making the baby lie down upside down and give them some water. Well, please do not try out such techniques. It could rather cause more distress or could be more dangerous to the baby when you try out such techniques. So use those simple tips which I have given you and it really works out. And even if you feel it doesn't, then all you have to do is just allow the baby to lie down peacefully and it will automatically go over a period of time. I have told you about how the different ways in which you can stop a baby if the baby has hiccups. But now I'm going to tell you about some simple tips or tricks which you can follow so that you can prevent your baby from having hiccups. 1. Feeding the baby before they become very hungry to keep them calm. Feed the baby frequently but in small amounts. Sitting the baby upright for half an hour after each feed is extremely important. Repositioning the bottle so that no air is near the teeth. Ensuring that the baby's mouth is completely latched over the whole nipple. So like I said, hiccups is an extremely common condition, especially among kids below 12 months of age. But at the same time, if you feel that your baby is getting hiccups very frequently, and if you feel that your baby is looking very distressful and agitated, then it is a cause of concern. Now, if your baby cries more often than usual, especially during the feeding times, or if they tend to arch their back excessively during and after feedings, or if they tend to spit up more often than usual, then it is of concern. Then we must suspect what we call as GERD, gastroesophageal reflux disease, and in that case it should not be delayed and we must immediately consult a doctor. So I hope I have helped those newbie parents in a small little way at least, because I know it can be quite stressful when you see that your little baby is having hiccups quite frequently and you do not know what exactly could be the reason or probably how you could prevent it. So I hope if you just follow these little simple methods, I'm sure both the baby as well as you would be absolutely happy and stress-free. Have a good day. Bye-bye.